selection periods for next year. We've got C-SNP capabilities, we've got PACE capabilities. There's no reason that you can't continue to help clients enroll in plans throughout the year, right? Right. So that's a great segue into our next presenters, who are Zing. They're in the C-SNP market, but they also offer products for traditional Medicare as well as D-SNP. So without giving too much of their presentation away, I will turn it over to Ryan.
Good afternoon, everybody. Luckily, lunch just ended, so you won't be tired yet. We'll go ahead and get started. This is our 2025 product and expansion overview. We'll move through this quickly. With the time allotted, so we'll try to keep it on task. I am here all day, though, if you have specific questions. You'll also see a QR code for me here in a second. But I am joined today by our VP Partner Sales, Chris Murray, who some of you know. And then there's this guy. But if you scan this QR code real quick, you can download my contact information right to your phone, or you can stop by, grab a business card. Just don't beat me 30 business cards. I don't need them all from one person. But in all seriousness, please, if you ever have questions when you're out in the field, call, text, email. You just determine ultimately the sense of urgency. I try to be responsive as possible. Sometimes I'm standing in rooms like this where it's not easy for me to take a call. Unless you want me to put you on blast, then just give me the green light. Real quick, some of the topics of discussion. We'll kind of talk about who Zing is, where we're at, where we're going. We'll talk about our plan types, and then we're going to get into the portfolio highlights where I'll try to spend most of the time to really highlight what we're doing for 2025. We'll talk about some of the supplemental benefits, and then we're going to get into the broker resources, the tools that we provide you to help you grow your business out there, and we'll drive that home. So a little bit about Zing. Zing Health is a provider-founded Medicare Advantage organization, really focused on serving those that are chronically underserved. So you heard, hey, we're in the C-SNP market. It is a rapidly growing market. And we are looking to really carve out our niche in that space. But we do offer very competitive products in your general enrollment and D-SNP space as well. So we're not just C-SNP, but that is kind of a big focus area for us. Someone asked where the name came from. Our founder, Dr. Whitaker, it really came, Zing. What do you think when you think of Zing? Amazing, bigger, everything like that. Really focusing on the health of the whole person. We achieve some of our vision and strategic goals by focusing on these 4 critical areas. So you can see differentiated product design. We have a full suite of Medicare Advantage products that you'll see here shortly. And in those, we really focus on investing in not only the core benefits, but those supplemental benefits that are actually going to help people get on a pathway to better health. We're ultimately trying to create good, positive health outcomes for the community. Industry-leading customer experience. If you're like me, you've seen the score 67 at some point in your academic career, which meant a D. However, compared to an industry average of 29, we're pretty remarkable. So, everything we do centers around that member. Every aspect of the organization operationally really has that positive member engagement at the center of it. Integrated care delivery, that's really empowering our provider partners, whether it be on the specialty side, through our value-based care organizations that we partner with, to really focus on driving those clinical outcomes that lead to healthier folks. Because our goal ultimately is to keep people at home longer, keep them out of the hospital, and keep them healthy so they can have longevity as well. And then a part that matters to most of you, we have robust sales and marketing opportunities. So not only having that differentiated product design that gives you something that you can educate folks on that they're not super familiar with. I still get questions around what the heck is C-SNP. So imagine how the consumer feels with all the chaos that's going around anyway. So it gives you something that you can present to them, but we also give you all sorts of resources, whether it be tools that you can use or marketing opportunities that you can do. We'll talk about some of that as well. So we're trying to help you grow your book of business with a piece of that being Zing. Where we're at, and I have the mic, but Chris, whenever you want to jump in.
Yeah, I mean, what I'd like to just touch on is kind of where we came from, as Ryan just talked about what happened last year and where we're going for 2025, just for me to add a little bit. When myself, I joined Zing about 2 years ago, we had roughly 2,800 lives in 3 different states, right? So the whole plan was big focus on growth, but it's a hyper focus on the niche market of C-SNP and D-SNP space. So that SNP space is where we're really going to live. And the 13,000 lives plus lives that we had in July of this year is now 14,000. We've seen tremendous growth in the last 18 months, and it's been along that chassis of that C-SNP focus. And if you have not sold a C-SNP yet today, I guarantee you that's going to change for 2025 and next year. With the changes in regulations, and then obviously with what we've been able to do to kind of remove some of those barriers and provide solutions around that differentiated product design, it's more compelling for you to have this in your portfolio, and it's easier for you to present to a member who has diabetes, who has chronic heart failure, who has cardiovascular disease. The truth of the whole opportunity and why we've seen this kind of growth in the last 18 months, really in a year, has been the opportunity, building awareness with you guys and some of your members. Roughly 45% of all Medicare beneficiaries across the nation have one of those chronic conditions I just mentioned, diabetes, chronic heart, and cardiovascular disease. That's a huge opportunity. That's one out of every 2 appointments that you're running, right? Diabetes obviously being the really easy one to identify, but there's a lot of tools that Ryan will come touch on that we can help you guys with to help further identify these and present to you a true opportunity, a true year-round selling opportunity that has recently changed because of some of the regulations of CMS. So really excited about where we've gone and then kind of where we're going. Overall, obviously, we're doubling our footprint here in Michigan, which we're really, really excited about. Ryan's doing a great job of being able to work with you guys and more of our partners. But also expanding into Cleveland, Tennessee, and Mississippi area, and some contiguous county expansion in some of our other states. So if you do sell in some of those other states, come see us, talk to us, raise your hand, we'd love to chat with you. But for Michigan, we are really, really excited. This has been one of our core markets, and we continue to invest in this space and have more to come for 2025 and 2026. I'll let you kind of touch on this one, but some of our key bets.
Yep, so again, like Chris called out, these are the key bets being made. I'm not going to read these line item by line item, but $0 premiums, maintaining our $0 premiums across our entire product portfolio. PPO cost share parity, so for those that have the PPO, which will be 5 of the 6 counties, that means the in and out of network cost share is the same. So if it's a $20 copay, it is a $20 copay whether in or out of network. So it gives those folks the flexibility and freedom to offer that. Continue to invest heavily in those BBID and SSBCI benefits around food and utility assistance, really giving folks the dollars they need to help, focus on that whole person. There are other aspects of just being able to get to the doctor and things like that, and go to the doctor, get your medications. That plays a big role in their overall health as well. C-SNP enhancements, again, this is where we continue to disproportionately invest, with whether it be the Healthy Food Utility OTC benefit, whether it be the Tier 6 formula that has a $0 copay, which will show you a list of those drugs as well. Lowering those specialist copays for those C-SNP specialists. So, those C-SNP specialists, which we'll talk about, there's 7 of them that have a $0 copay when they go to see those specialists. And then the chronic meal benefit, which I think is really great. So for those that need that lifestyle modification to get, their chronic condition under control, we will provide them meals for that to help them make that transition to eating better, to take care of their nutrition and ultimately their health. Whoops. And our, other additional spends, with the Flex Card for dental vision hearing, some of our plans, we continue to provide those benefits. And then our Max Out of Pockets are very competitive. So kind of talking about our portfolio improvements, won't spend a lot of time here. The biggest one I like to call out is network improvements. We've made a lot of headway over the last year, and they continue to work heavily on it. I know there are some misses, but the team is working to correct those. And please, we want your feedback. When you have providers where you're like, hey, you're missing this cardiologist or this PCP in my community, send that to us. Our provider team will do outreach to try to engage them and get them into the network. And at least a bare minimum, if they are willing to take the PPO, we'll educate them on the claims process so you don't run into any issues. Plan type overview, most of you guys are familiar with HMO, PPO, all that jazz. I would just like to call out the chronic special needs. These are designed for folks that have specific chronic conditions. We focus on heart conditions, so cardiovascular disorders, chronic heart failure, diabetes, and end-stage renal disease. And then the other one I like to call out is our provider-specific plan. You'll see these called out there are the elite plans when we get to the plan types. So anything that has a week in front of it is our provider-specific plan. These work with a subset of the PCP network. So they do have to name a PCP from that, which is currently Oak Street Health is our partner in that space. So that's more of our value-based care providers. The reason we do that is ultimately, these relationships with value-based care providers lead to better outcomes. Better health outcomes because the data sharing that happens in the background, being able to leverage each other's care models and things like that to where they can focus on the clinical, we can share data with them that empowers them to do a much better job, and we're getting more feedback to ultimately drive positive engagement as well. Through those risk-sharing agreements, it allows us to invest more into those plans, so you'll see some benefits that are a little bit higher in those PSP plans. And then last, growth opportunities. So like when you work with Oak Street, and there's others out there, but right now Oak Street, and soon to be Village MD, will be in that category. They have opportunities to grow with them. They're trying to grow their patient panels. We're trying to grow, you're trying to grow, so it kind of creates that trifecta of winning, where everybody kind of goes, and then the consumer ultimately gets like solid plans that gives them the benefits they need, and then ultimately they get the care they need, and they're happy campers. Looking at our plan types, again, we have the full suite of product. We won't talk about that one there because we are fortunate here in Michigan to actually have the D-SNP. So we have the HMO D-SNP in all 6 counties, and then the PPO D-SNP will be in 5 of the 6 counties, which we'll talk about. Kind of already called this out. I probably should move this slide around a little bit as I'm going through it again. But the PSP, again, the advantage, better benefits. We're able to invest because of their risk sharing agreements, and then ultimately they have to list a provider from that subset of network, which is currently Oak Street, soon to be Village of B to be added to that. The C-SNP, you can see here we're investing in those, the core benefits, but the supplemental benefits where they need it most. So with that transportation, $0 copay for those C-SNP specialists, tier 1 and tier 6 at a $0 copay. Insulins, our insulins in our formulary are $0 copay as well. Additional services like in-home support through Papa Care and things like that. The opportunity. If you haven't already heard, everybody keeps talking about C-SNP. Huge opportunity in the C-SNP space. As you can see, 1 in 3 Medicare eligibles have diabetes. So a huge opportunity to really empower them to, get better health outcomes, utilize the resources that are in these types of plans. I think we're head and shoulders against, above some of the competition in the space, but a huge opportunity that ultimately have benefits designed for the member at play. It allows the physicians to focus on the clinical outcomes, and then for the agent community, it's a year-round sales opportunity. You can see not a lot of folks that have these eligible conditions are in C-SNP plans. So not only is it a great opportunity for you to be able to engage them about something they're not familiar with that you can educate them around, you can do this year-round. So you can see C-SNP, any Medicare eligible that has one of the qualifying chronic conditions and is not currently in a C-SNP can move into the C-SNP. So that means right now, if you're ready to sell with Zing, or if you're not, you should be. If you meet Mrs. Jones tomorrow, and you're like, hey, everything you do the needs analysis, you uncover that she's diabetic, you can enroll her for a 10-1 effective. So really great opportunity, and it's going to be even better next year as we look at kind of some of the chaos coming with the LIS and the D-SNP space, where it's going to be a little bit of a challenge to move people appropriately into 2025. There are other chronic conditions that you might see focuses on. So it'll be a really great way to kind of carve out a niche and really provide folks with the benefits that they need. One of the areas that we focus on is end-stage renal disease. So as part of the 21st Century Cares Act, folks are able to enroll in an MA regardless of their previous coverage, unlike prior to 2021. So about 1% of the population has end-stage renal disease, so this isn't going to be something you can go gangbusters over, but at the same time, it's a really great opportunity because these folks oftentimes then if they're not enrolling in MedSup or enrolling with Original Medicare, they're going into another Medicare Advantage plan now, and most of those have a 20% co-insurance for dialysis. With Zing, we're covering the dialysis at a $0 copay.
Wow.
So if anybody's familiar, the average cost, the cost for dialysis is $100 per visit. So if they're in an MA plan or they're on Original Medicare, they're paying 20% of that dental benefits, but you're going to save them $60 a week. Our duals plans, those do require that they be fully dual eligible. So FPD, QMB, QMB plus, and SLMB plus for those. We're coordinated only, so as we look into next year with the SEP changes, if you don't get them, and what I will say about the DSNP space, as we look ahead to next year, make sure if you're somebody that's built a solid book of business in the DSNP space, make sure you're touching those folks early in January, because that might be the only chance they have to move, and you don't want to be the second one in. It's not going to go your way. So it might mean a busy January, but it'll be worth it when it comes to your book of business. Because as we know, right now LIS, they can move quarterly, but when they're dual eligible or LIS, they can move quarterly into another MA plan. Going into 2025, that's going to change. LIS can move back to Original Medicare and unlock an SEP for PDP. And with the PDP space, I don't know anybody looking to do that. But then on the dual side, they have to enroll. They can do it monthly, but they would have to go into a HIDE or FIDE, one of those fully integrated or highly integrated dual eligible plans. And right now, I know there's a lot of information out about that, but right now that means they're very limited on what they can do. And as we look ahead to 2026, that's going to be a completely different load again. So,
And Ryan, if you don't mind, just to add on not only focusing on your DSNP members, but your LIS members are going to be in a real bad place if they cannot have that opportunity, that quarterly opportunity to move. And in fact, just a little bit about behind the scenes on the data with our CSNP plans is that actually typically about 65% of our members in our CSNP plans actually have LIS. So it's a very natural type of product that will be a very viable option for you guys if your members who are LIS come April, May, June need to make a plan change, they're not happy with it, a CSNP plan could be the right qualifying plan for them. So keep an eye out for both of those types of members during the AEP to make sure you can put them in the right plan and in the future in SEP.
So getting into the product portfolio, actually looking at the grids and everything that matters. I won't read every line. These are available at our First Look website as well, zingfirstlook.com. You can go capture these. I'm happy to share anything. But ultimately, we're with the expansion that Chris talked about earlier, we're increasing our addressable footprint by 40%. So really great opportunity to add more seniors, the opportunity to enroll with Zing Health and partner with us across more counties. I'm super excited about the expansion here in Michigan because we are going into 3 new counties: Macomb, the county I call home, which is super cool, and then Washington, Livingston County. And again, I'm going to try to keep us on as close to on time as possible. Plan types, so we're keeping all the same plan types as well. We did introduce a new plan in our CSNP space, which is a PSP so that partnership with like Oak Street Health and Village MD. That is a CSNP with, so it's the Elite Diabetes and Heart. Those elite plans will be available in Wayne, Oakland, and Macomb, where Oak Street has a prominent footprint, as well as Village MD in Oakland County. Our PPO will be expanding into the additional counties as well as Oakland County. However, unfortunately, Genesee does not have the PPO for 2025. And then all HMOs are expanding into the entire 6-county footprint. Key benefits, so we talked about the $0 dialysis, which is huge for those folks with end-stage renal. Other things I like to call out here, the $0 insulins across our formulary. So if it's in the formulary, it's a $0 insulin copay. Part D, Tier 6 formulary is a $0 copay for those select drugs. CSNP specialists, which are listed here, $0 copay, and then $0 copay for mental health, substance abuse, and psych care as well. Getting into the grids, again, I'm going to fly through this, so I'm going to call out a couple things and then kind of let you look at it. The dental vision hearing, those are allowances. So they have the, the 2,500 or the 2,000, whatever the plan type allows. That's an allowance. So if it's a covered service, they will get whatever that, covered service costs that'll pay towards that allowance. There's no built-in co-insurance or copay. The allowance for vision is for contacts, lenses, and frames. And then hearing in all of our plans is $750 per year every 3 years. Flex cards are Select Care, which is our HMO, has a $305 flex card. The Open Choice PPO has a $260 flex card. Transportation, the Elite has a 48 one-way trip benefit, and then the Select has a 38 one-way trip, and then OTC 168 per quarter, and the Elite, the Select is 132 per quarter, and then 174 per quarter in the Open Choice PPO. And then for those members, like Chris called out, a lot of folks have that LIS. If they have LIS in the Elite, they'll get $122 per month in allowance for groceries and utilities that they can utilize. And in the Select, it's $55 per month, and in the PPO, it is $50 per month.
Yeah. If you have an LIS member who does not qualify for CSNP, but they're looking for groceries, that's a great plan for them. Because if there are LIS, they automatically will get those groceries on that grocery benefit on a monthly benefit. So.
Fast forwarding to our C-SNPs, the big call outs here, $0 specialists for the C-SNP specialists, so these 7 listed here. I think that's 7, yep, I can count still. So the $0. The Flex Card, $350 on the Elite Diabetes and Heart, $750 on the Select. 30 one-way trips in both the HMOs. Our PPOs, we do not offer transportation on our PPOs. And then a little different than our general enrollment D-SNP, the grocery, utility, and OTC is a combined allowance through SSBCI. So that Elite is going to be $174, the Select $125, and then the PPO $166 per month. So they'll get that, on a monthly basis. That will load onto that prepaid debit card. Our PPOs, again, for those that are fully dual eligible, well, the dental vision hearing is going to be, that additional benefit. The HMO offers 36 one-way trips. OTC 122 per quarter in the HMO. The PPO is 121 per quarter. And again, if they have LIS, which most folks that are going to be fully dual will have LIS, if not, you have to help them apply for that, walk them through that process. They'll get 188 per month in grocery and utility, and then 147 in the PPO. ESRD, the ESRD C-SNP, obviously the big one, the $0 specialists, the $0 dialysis, putting that money back into their pocket that they would normally be paying on a copay. Unlimited transportation, $500 flex card, and then $157 in grocery, utility, OTC, combined allowance on a monthly basis. Provider partners, hopefully we'll be able to add a couple more here very soon, but right now Ascension, Corewell, Michigan Medicine, Tenet Health, which is your Detroit proper area hospitals. DaVita and Fresenius are our partners, our big partners in the dialysis space, and then Oak Street Health. Supplemental benefits, I'm going to fly through this. Dental is Liberty Dental, iMed is the vision, Nation's Hearing is the hearing benefit. Telehealth, $0 copay, and that includes behavioral health as well, so they can get a $0 copay through telehealth. Prepaid debit card, that all new members will receive a prepaid debit card that'll reload based on their benefits. So if it's quarterly or monthly, they'll get that allowance appropriately. They can utilize that here locally, CVS, Walmart, Kroger, Walgreens, and Rite Aid if they still have any product left on the shelves. Silver and Fit, all the Rite Aids are closing in Michigan if you're not familiar. Silver Fit is our fitness and gym membership, so they can utilize their participating locations as well as at-home services that they do provide as well. For our care management, some weight management, nutrition and dietary counseling, as well as medical nutrition therapy. In-home support services through Papa Care, personal emergency response, bathroom safety devices. Our member services team can help facilitate these services. Utility allowance, I'd just like to call this out. It is for your traditional utilities, electric, gas, heating oils, sanitation, water. Unfortunately, it doesn't cover rent or telephone bills or cable like some have in the past. We'll skip ahead. Again, the grocery allowance in those plans, then whether it's PBID or SSPCI, they'll get that on a monthly basis. Post-discharge meals, 10 meals after discharge from an inpatient facility. And then the chronic meal benefit I mentioned earlier, they get 28 meals provided to them when a doctor orders that lifestyle modification. So it is a supervised program, but they will get those meals delivered to them to help make that. It pairs really nicely with that healthy food benefit, because now they know what healthy food for them looks like based on what they need nutritionally, and that now they're empowered to go out and purchase that on a monthly basis. You know, we're helping members get their Zing back. It's covering some benefits. It's a tier 2, which the mail order is a $0 copay. So there's a quantity limit of 6. If they need more than that, they'll have to find the other ways they get it normally. Continuous glucose monitor, $0 copay. For anybody not familiar, this is a device sensor, gives them their glucose readings every 5 minutes, lets them track any trends and gives them insight. Here are our insulins that are $0 copay in all of our plans. And then here's the tier 6 formulary that we're covering at a $0 copay as well. So you'll see some big ones: Ozempic, Rybelsus, Jardiance, Xarelto, some commonly prescribed name brand drugs when it comes to those C-SNP folks. Covered most of this as we ran through it. I know we're running up against time, but no referrals when they stay in network. So if they go to a network provider, they do not have to snatch a referral. And then we've reduced and limited our prior authorizations, really trying to streamline the care that they get, make sure they get the care when they need it without any hassle. Resources, real quick. If you're not already contracted, just do it. But in all reality, you'll get an onboarding invite from Evolve NXT. It's also what serves as your broker portal. So you can track commissions, do your certification, all your licensing, all that jazz lives in that. We do have a guide that can walk you through that if you aren't already contracted. You can get that from the team, or you can ask me to get you squared away. Supply marketing portal. All of our ready-to-sell agents get access to this. You can order sales materials. 2025 is available for pre-order. We also have CMS-approved Facebook posts that are customizable to add your contact information and website and everything like that. It does have to be posted on a business account, though. So if you don't have one of those, I can help you get one set up. They're free. And then marketing materials. All of our brochures, flyers, postcards, all sorts of stuff is loaded in this as well, and it's all customizable. So it adds your contact information, your logo in some cases, as well as everything you need. So any work that you do out in the community and leave one of these behind ends up back in your lap versus an 800 number. Enrollment methods. So all of our RTS agents get sent, and then we work with Connecture as well as Sunfire as well if you have one of those available to you. And then if you're a paper application person, we do accept those via fax as well. And the number, you don't have to jot that down real quick, it's on all the paper applications. You can gather more information as well at zingfirstlook.com. I'm here all day and happy to talk at length about anything, any questions you have. I know we flew through this, but we do have some value partners, one you're going to hear from in a little bit. Advanced Diabetes Supply, I'll let her tell her story. They're awesome because we have $0 diabetic supplies. They're really great to make sure you're protected. They're going to help protect your agent of record, but also make sure your client has everything that they need when it comes to diabetic supplies. City Block is a virtual provider that kind of steps alongside the member and their current providers to help them reach their health goals. Then you have Perry, Story, and Strive. These are specialty. They're virtual, so it just increases the member engagement around their condition. So you have Perry, which focuses on diabetic care, Story, which is cardiac conditions, and then Strive, which is kidney conditions. You can scan my QR code one more time if you really want to add me to your phone. And then if you sell in Illinois and Indiana, we also have Alex and Sarah, who are awesome, who can support you on that local level. And then Jason is our regional broker manager or regional broker director, and he's helping support all markets. Marketing outreach specialist, if you want to do events, want us to support your events, work with me and Don. Don Sims-Carter is our marketing outreach specialist here in the market. He's at an event pretty much every day, so he'll keep you busy if you're willing to do the hustle. So just reach out to the diversity team if you want contracting. We are going to be having a kickoff next Tuesday here in Livonia, but at Dave & Buster's, so you can come win big with Zing this AEP and enjoy some good time. Yep, so scan that QR code, you can register. If you're already contracted with us, you've already seen a ton of emails from us about this, so do that. But I'll turn it over to you, Chris, before we
just to kind of wrap it up, and one thing we failed to mention and put in the deck is that we will continue to pay on HRAs that are completed. through our Ascend platform, as well as through Sunfire. So if you use those two, those are embedded into the platform. You can also use the external Ascend site as well. And we will be paying $100 per CSNP and DSNP enrollment. Okay? So please do those with every single application. Because I will tell you, there's regulation that could be coming in the near future that those could all go away, right? So make hay when you can. It's a great opportunity, and we'll continue to pay on those. And then just to kind of wrap it up and pull it together, there is a very real scenario when you enroll somebody into a Zing Health CSNP that they could have no cost, no co-pays for PCP, a CSNP specialist such as cardiologist, and then if they're taking Jardiance, so Ozempic, Januvia, some of the GLP drugs, maybe insulin, there's no cost share for all of those. So bringing that all together, I think is very important to think about the different types of members that you guys run into on a daily basis and start to consider Zing in your portfolio. So appreciate your time. Ryan's done an awesome job. Looking forward to a great AAP with you guys. Thank you.